to me, having the right consultation is just as important as having a great surgery, right? Because I'm sure you come across guys every single day that just straight up aren't hair transplant candidates at this point. They're not using any preventative medicine. Their hair loss has already progressed to the point where no matter who does their surgery, even though it's the greatest surgeon on the planet, it's going to be a horrible result, right? It's not, they're not going to be happy at all with how it looks. And I think a lot of clinics are still doing these surgeries and they're not turning those patients away. And that's like a huge problem I'm seeing.
Yeah, exactly. They're creating future repair cases. That's what they're doing. Yeah.
Yeah, at that point, they've already destroyed so much of their donor hair, and they're usually so bald that it's going to be an uphill battle and a very expensive one.
That's also one good thing, that you also have to check whether the clinic that you are going to can do repairs. That's such an easy check, which can already tell you a lot about how good the clinic is or isn't. Because usually the clinics that are not as good, they're not doing repair cases because they cannot do it. They don't have time to do it, and it's not a lot of money. Like a repair case doesn't make you a lot of money as a clinic, because the guy just needs some hair extracted, maybe have it re-implanted on another area. Then we are talking about maybe 500, 1000 grafts maybe, because usually even if you are doing repair and you're removing some grafts from the hairline, for example, the doctor has to do like some test extractions from the hairline to see how it will heal after a couple of weeks before he starts removing maybe the whole hairline. So he starts maybe with 100, 150 grafts, and then you will have to come again. So it's very tiring process for the doctor. He's not going to make a lot of money from you. So that's why these clinics are not interested in doing that. So if they're not interested in doing repairs, they should at least be focusing on providing like really good results right away, so the patient won't turn into repair cases. But this is not what they're doing. They're just accepting a virgin donors. Virgin donor is somebody who has never done a hair transplant. His donor may not be like super good, maybe just average or even below average, but they accept him because he has never done a hair transplant, and it's going to be very easy for these clinics to use the donor, at least extract like 3000 grafts or so, and leave their mark on his donor. And that's how it ends usually. Usually such guys never go to the same clinic again. They just get smarter after the first transplant and go to a better clinic.
But yeah, at that point, they've already destroyed so much of their donor hair.
Pretty much.
They're usually so bald.
Pretty much.
It's
Yeah, man, I've seen scars. I've seen scars on donor areas from guys who have done like FUE in some unnamed clinic, and they have been told that they used micromotor with a punch of 1 millimeter but for the extraction, for the FUE. But once I looked at the scars, and I was at another clinic where we were having this repair case, and I was looking at the donor through the loop, and also we had the trichoscope and we were looking at the donor, and these scars were almost 3 millimeters large. Okay, so how fast the staff had to work with the micromotor, so it almost kind of left a 3 millimeter diameter imprint on the donor instead of 1 millimeter. So that was pretty crazy, and there was multiple of these scars, and of course the patients also didn't get a good regrowth after that. And this case happened like 7 years ago, but still, I mean, was pretty drastic to see that.